I think you heard about the story that six blind people, visually impaired people, went to a zoo and they wanted to see an elephant and how they appreciated, like how they uh, understood the elephant. Like one was holding the legs and that person was telling it is like a tree. One was holding the tail and that person was saying it is like a rope. One was holding the belly, trunk part, and he was saying it was elephant is like a wall. Somebody was holding its trunk, and then he was telling it's like snake. सभी ने ये कहानी सुना है ना. Imagine if same thing happens in diagnosing skin diseases. अगर ऐसा ही कुछ सिचुएशन आ गया है जहाँ पे ऐसा सिचुएशन आ गया है कि हर एक एंगल से अलग अलग, लाइक हर कोई अलग अलग डायग्नोस कर रहा है और हर बार ऐसा हो रहा है. सो इट्स लाइक डायग्नोसिंग एन अननोन स्किन डिजीज. इट्स लाइक trying to identify something with blindfold on, right? What if such situation occurs in our clinical practice, particularly when we are diagnosing skin diseases, right? Only three things. Only three things you have to do to overcome that. Namaste. Welcome to Dr. Mahesh speaking. Today we are going to discuss about diagnosing an unknown skin disease, right? I'm practicing since 2008 Ayurveda Dermatology, right? Based on that, I'm able to say that these are the three important things, but very important, uh, that will help us to diagnose any kind of skin disease based on Ayurveda. Any type of skin presentation, we can easily diagnose and plan the treatment. Diagnosis is not the end, right? We need to be planning the treatment. We need to be treating the condition, right? We will be treating that one. So just three things we need to do. Now, why it is important, right? How to understand this? It's very important because as we see in text, we see some of the clinical presentations explained in text, like disease 1 will be having these type of presentation, disease 2 will be having these type of presentations. But what happens is because of the changing etiology, the disease pattern is changing. It's not new. It is not new. Even it is explained in Charaka. Right? In Charaka Chikitsa, Kushta Adhyaya, what Charakacharya says, Kushta Visheshair Doshaha, Dosha Visheshaihi, Punascha Kushtani. Nyayante Tair Hetur Hetustamsha Prakasheti. What he says, Kushta Visheshair is Dosha. Right? Particular Kushta causing particular doshas will be there. Right? Or particular doshas will be there which will cause particular Kushta. They are same, right? They look like they are same, but they are different, right? Because, for example, Vata Prakopa, that is caused due to, we know the disease Kalaya Kanja, right? Something which is caused due to Kalaya Sevana, there is Vata Prakopa, and that leads to Kalaya Kanja, right? So, all Vatakara Nidana will not lead to Vatavadi, right? All Vatakara Nidana will not lead to Vatajakushta, right? They are linked, they are connected, they are very specific to particular disease or particular system or particular pathology. So for that purpose, we need to understand this, right? So what Acharya Charaka says, how to understand this? It's like Purva, what Sheshavat, Karyat Karnanumana, Karyanuman, like that. कुष्ठविशेषैर् दोषा इति कुष्ठविशेषैः कपालादिभिर् दोषाः वातादयो ज्ञायन्ते. Like if we are able to diagnose the disease by name, for example, if a person is suffering from some skin presentation and if we are diagnosing it as Kapala Kushta, then we'll be understanding that it is Vataja Kushta. Tata Dosha Visheshaihi Punah Kushtani iti. Like if we are not able to diagnose the disease by name, like we are not able to identify it as Kapala Kushta, then how it is understood? By Lakshanas, where dosha is assessed. वातादिकोऽयं पैत्तिकोऽयम् इति कुष्ठदोषे परिज्ञाते दोषविशेषज्ञानात् विशिष्टानि कुष्ठानि ज्ञायन्ते. So either we diagnose the skin disease by roga vishishta jnana, that is nama jnana. We are very particular. We are very strong in identifying a skin disease by its name, right? This is one. When it is done at that time, first disease is understood and then the dosha will be automatically understood. Like if we are diagnosing it as Kapala Kushta, then 100% it will be Vata Pradhan, right? If we are not able to diagnose it by name, which is what happens in present day, because the pattern, disease pattern presentation is changing. What we see in text may not be the same. Like for example, 18 types of Kushta, Visarpa, and some Kshudra Rogas are explained. Otherwise, there is no other skin diseases, right? But we have thousands of skin diseases, and all of them fall in the category of any of these three, right? They will be falling in these only. But the presentations are changing. They are not the same presentations as we see in text. So when the presentations are changing, we need to understand that why they are changing. They are changing because of changing etiology. So presentations change as per the etiology, right? So that is why we need to be understanding in multi-direction. When we are not able to diagnose a disease, or when a disease is having a different presentation, that presentation which is not explained in the text, then it becomes difficult to diagnose. But it's not that difficult. Few things we have to do. That is what things most difficult to understand are the most simple things. We fail to implement simple things, and we keep on focusing on very high level things. So that is what happens, right? Now in this again it is said, tata yah kushteshu aparijnato hetuhu sa dosha visheshai jnayate. Like when a person is not knowing etiology, he or she is not aware of dosha, what etiology might have led to this, then one can understand that how this etiology or how this disease is caused. It is understood by what it is said, kushtam vatottaram drishtva vatottara kushtajanakani ruksha virudha ashanadini karanani jnayante. So what acharya say, when a patient is suffering from Vataja Kushta, like Vataja link representations are there, at that time Vaidya has to think that this person might have or must have exposed to these type of Vatakara Nidana, right? Okay, when condition is known. Vice versa, opposite is Hetu Vishcha Dosha Vishesha Janakahi Kushtani Jnayante. Means by knowing the Hetu, like for example, sometimes it happens, some geological areas, some places, some states, where particular style of food or lifestyle is specifically followed and it's done by everyone. So there, by understanding that, we can say that this skin disease might have caused because of this type of etiology. That is what he says. Hetu bishcha dosha vishesha janakai kushtani jnayante. By knowing the hetu, we can understand what type of kushta is caused. Like yasmad anena vatottara kushta janakam sevitam tasmad asya vatottaram kapalam kushtam bhavishyati. So if a person is continuously consuming vataja kushtakara nidana, then that person in future is going to develop kapala kushta, right? Like that it is understood. So we can say that the food style, if we are able to assess, if we are able to assess the lifestyle, then we can make out that what type of kushta patient is suffering and which dosha dominance it is, right? Okay. Why it is needed? Why it is important? Understanding how to assess when the disease is presenting, having a different pattern at that time. We want to treat that, we need to treat that one, then understanding is very important. So one more important reference that we get from Charakanidana is Nacha kinchidasti kushtam ekadosha prakopanimitam. There is no kushta which is caused due to single dosha, right? Tridosha it's always. Astitu kalu samana praktinamapi. Even if there exists ekadosha prakopaja kushta also, skin disease also, dosha amshamsha vikalpa anubandha sthana vibhagena, na is connected with vibhage, right? It's not na. Dosha amshamsha vikalpa anubandha sthana vibhagena, when we assess the dosha amshams, like for example vataja kushta is there or vata dominant is there, whether it is ruksha guna, shita guna, khara guna, chala guna, like that individual gunas, when we assess, based on that what happens, vedana vishesha, vedana will become different, varna vishesha, varna will become different, samsthana, presentation will be different, prabhava, nature of the disease, prabhava, how it behaves will be different, nama, name will become different, and chikitsa also will become different. So as present day etiology is not exactly the same etiology that we find in ancient texts like in Samhitas and all. So as the etiology is changing, 100% the clinical presentations also change, right? They have to change, and they 100% change. That is what we see. So that is why the changed clinical presentation of a skin disease should be understood in terms of Ayurveda. Right? That is why it becomes like, understanding Anukta Rogas. It becomes something like Anukta Rogas, which are not explained in text, but we have to identify it. But we should not worry much about that. We should not fear about anything. Like one example I'm giving. When we look into the Paduka Visha, I belong to Agatantra department and practicing Ayurveda Dermatology. So I'll give example from this. Like for example, condition is there called as Paduka Visha, which is very much comparable with allergic footwear dermatitis, even irritant footwear dermatitis. We will consider allergic footwear dermatitis. Now, what is said in text? Shopasrava tata swapaha padayoho spota janmacha bhavanti vishajustabhyam padukabhyam asamshayam. So, when a person wears contaminated footwears, which were contaminated with poison, it was practiced at that time to harm somebody others. So that will lead to shofa. There will be strava, swapa, altered sensation, pada yoho on both the foot, and there will be spotajan, blistration and all. Right? It will happen. Right? It is said. Now it is exactly allergic footwear dermatitis as per the text. Now in practice, we find these type of presentations also. Whether we have to diagnose these as Paduka Visha or not. Anyhow, they are diagnosed as allergic footwear dermatitis. All these three. But whether we need to treat it means we need to be placing these conditions under some heading, under some category to select the medicines and all. So we have to diagnose them as Paduka Visha. Right? But presentations are different. Whether we have to consider them as Paduka Visha or not, we have to consider it because the etiology is different. In ancient period, the commonest poisons that were used for such purposes were Chitraka, Bhallataka, Hartala, arsenic. Those things, Nuhi, Arka, they were Tikshna, Ushna in nature. So they did a kind of Pittaja type of presentation. Now, when we look into present day, like for example, formaldehyde and all, they all are Vatakara in nature. Most of them are Vatakara in nature. So when the clinical presentations are showing these type of presentations, then also we have to diagnose them as Paduka Visha. Only thing, the presentation is different because the etiology itself is different. Dosha, amsha, amsha, hetu, amsha, amshalam. Right? Hetu, qualities of hetu are different. So that is why clinical presentations are different. Now, how to do it? Nothing to worry about. I told you, we should not worry about this. Like when we are not able to diagnose, I will show you some of the conditions where I was able to treat them successfully, even though first time I heard about those diseases. Later, after treating or while treating, I read about those diseases. Right? Why we need not worry, because it is said in text that Shastre Anuktam Swayam Muhaniyam. If something is not explained in Shastra, then it's our duty to understand, imagine, and correlate. Right? There is one quotation in Ashtanga Hridaya, 12th chapter, Sutrasthana. Vikaranam akushalo na jihnyat kadashana. Vikaranam akushalo na jihnyat kadachana. Nahi sarva vikaranam namatosti dhruva sthiti. What he says, vikaranam akushalo. Vikaranam akushalo means namato akushalo. If Vaidya is not able to diagnose a disease by its name, then na jihnyat kadachana. कभी भी शर्माना नहीं चाहिए. Like the such way they should not feel inferior. Arey yaar, I am not able to diagnose this case. No, we should not do like that. Why? Because nahi sarva vikaran namato asti dhruvam sthiti. For every clinical presentation, for every pathology, there is no existence by name in Ayurveda. Right? We cannot label every disease, every pathology by a particular name. It's not possible. Right? Further, it is explained in commentary very nicely. It is said, Yo vikarasya vatajaditvam. Yo vikarasya vatajaditvam janati. Nama na janati. The one who is able to understand the dosha involved in that pathology, how that pathology was set in, but nama na janati, but not able to understand, not able to find the name or not able to diagnose it by name. Why? Shastra Anuktatvat. It is maybe because it's not explained in Shastra, or Sankirnatvadva, or the disease is so complicated. The presentation is so complicated. Because of that, if a person is not able to diagnose a disease by name, sa nah jihniyat. लज्जाम न कुर्यात, शर्माना नहीं चाहिए, inferior feel नहीं होना चाहिए. One should not feel inferior because न ही सर्व न ही नामादिनाम न ही नामादिना सर्वत्र चिकित्सा. वातजाति ज्ञानम ही चिकित्सायाम प्रधानम कारणम. So no treatment is explained by name of the disease. Even if you see the Kushta Adhikarana and all, whether you take any Samhita, no problem. We hardly find any chikitsa explained like, this is the treatment explained for Sidma, Kushta, like Eka Kushta Chikitsa, Kapala Kushta Chikitsa, or Udumbara Kushta Chikitsa. Like that, we do not get Charma Kushta Chikitsa. No, we do not get such explanations. Hardly few for, external applications are there. Sidma Haralepa, Vipadika Haralepa. Only few external applications are there which are by name of the disease. Otherwise, no treatment is explained by name of the disease, right? Under Kushta. Under Kushta, no treatment is explained by name of the disease, right? So ultimately, what is the base? Base is the knowledge about the dosha and the pathology, right? So that is why we should not worry much about that. I was telling you about three things that will make us or make this process of understanding unknown diseases, Anukta Rogas, Anukta Twak Rogas particularly, is the modern principles of diagnosis. That is morphological diagnosis, clinical diagnosis, and etiological diagnosis. We'll just understand them in brief. Now, what is morphological diagnosis? What is morphological diagnosis? It's the process by physical observations, like identifying and classifying skin lesions. Hmm? By seeing the morphologically how they are appearing, like primary lesions, secondary lesions, what is the color, what is the shape, how they are arranged, how they are distributed, right? These all will come like that. Like primary is like macule, pustule, flakes, and all those things. If there is a crust, whether it is crust means there should be secretions or something like that. So that secretion or pus will become primary and crusting will become secondary, like that. Okay, this understanding this is called as morphological diagnosis. Now, clinical diagnosis, it involves mixture of morphological diagnosis with history taking and all. Prashna Pariksha, Darshana and Prashna, both will come in this. Now, it involves visual examination and gathering the information about patient symptoms, history, and characteristics of any lesions, whichever are present, about them. So, understanding characteristics, matlab kaise hota hai, how it is spreading. We'll ask the patient how it is spreading. Is it very quick in spreading? Is it taking more time to spread, or whether the pustules are formed every day? Whether one, like for example, there is acne, how much time it takes to break open? Whether it break opens or not? Like that, we ask the questions. We are taking physical characters and mixing it with the Prashna Pariksha, right? So like visual examination, size, shape, color, distribution, abnormalities, all these as in morphological. Next is history. History, onset, how it started, what is the duration, are there any complaints like burning sensation is there, itching is there, all those nature of this. If it is itching is there, at what time itching will be there? Is it in the morning or is it in the evening? Whether it aggravates with cold or it subsides with cold, like that those things. And characteristics of the lesions. Characteristics, matlab, I think in somewhere in one of the video dosha assessment part 2, I think I have shown you. Like for example, Anyonya Sansakta. Anyonya Sansakta matlab clustering. That gives idea about there is increased kapha. Right? That is whether they are solitary, single are there, they are widespread, or are they arranged in groups? Are they arranged in linear direction? Are they circular in arrangement or like that? All these things. What is done here? Morphological, Darshana and Prashna are mixed here. And the third one is etiological diagnosis. In this, identifying the root cause. What causes this condition? Not just name of the disease, right? Finding potential causes or etiology, even including risk factors also, or any what we can call triggering factors, or all those things. These will help us to diagnose the disease, right? Now, how to use it in clinics? How to use it in clinics? I will go with one example. We'll consider Bahir Parimarjan Chikitsa, like external therapies. We'll take example and we'll discuss some three clinical presentations. For example, skin mostly presents with atirukshata, one condition. There is another condition in another patient. The lesions have more strava, right? There is one more condition in another patient where skin shows pidikas, right? Pidikas, bumps, all those types. Elevated lesions are there. Pidukas don't take literally them like blisters or something like that. Okay, they are elevated lesions, right? Okay. Now the question will be whether, as there is dryness, whether I will decide that as dryness is there, I have to go with Taila method. Whether I have to use Tilataila or Kshirabala Taila. For example, there is Srava, so I want to do stake. I want to wash the lesions. Whether I have to use Aragoda Kashaya or Panchavalkala Kashaya. There are Pidakas. Whether I want to do Lepa, right? Whether I have to do Tikshna Lepa, Nati Tikshna or Kshara application, Aji Tikshna. Now, how it is understood? How to understand this? Morphologically, we got these things. Now we have to mix it with clinical diagnosis. What clinical diagnosis mostly in terms of Ayurveda gives, mostly understands the disease. In clinical diagnosis, we try to understand the disease by its property, type of disease category. Like even if we are not able to diagnose by name, at least category. Whether is it Kleda Pradhana, Vata Pradhana, Dhatu Kshayajanya, something like that. We are trying to place them under a category, and sometimes even we may come out with a name also, right? So this will help us to decide. Now, for example, now Atirukshata is there. So with clinical diagnosis, what we were able to decide, we were able to decide whether it is Pushta or Vataved, right? So still we want to do Abhyanga. So if it is Kushta, then we will go with Iladi Taila. If it is Vatavadi, then we will go with Shirabala Taila. Because the context, in the context, which context that Taila is explained based on that. Like there is Srava. So in clinical diagnosis, we will understand whether it is Kapha Pradhana Srava or Pitta Pradhana Srava. If it is Kapha Pradhana, then Aragoda Kashaya. If it is Pitta Pradhana, we will go with Panchavalkala, right? Like I told you about Pidakas, right? If there is Mukadushika, acne is there, then we may go with Nati Tikshna Lepa, right? If there is Vidra diarrhea abscess, then we may go with little Tikshna Lepa. If there is a Granthi, cyst-like presentations, then nodular presentations, we may go with Shara. We may go with Shara application, right? So this helps us in diagnosing, mixing, right? When it comes to etiological diagnosis, understanding the root cause, this will help us to plan the etiology specific, even external and internal medicines. Now, for example, how to understand this etiology? How to understand etiology? It is said, na, like Kushtesho Paridnyato, like when the person is not knowing about the type of, like, which etiology might have caused. So, by seeing Vata dominance, we can think that there is Vatavardhaka Kushtagara Nidana. By seeing exposure to Vatavardhaka Kushtagara Nidana, we can say this person has developed Vatasya Kushta, right? It is Anumana, right? So, how it is done? I use this principle like Anumana, Karyat, Karananumana, and Karanat, Karan. Karanat, Karyanumana, and Karyat, Karan. Based on these two, we will see case. Like, for example, a kid came with the complaints of sudden onset of reddish papules on lower and upper and lower extremities. Lower first written because they were dominant on legs, and lower abdomen associated with burning sensation. Rarely itching was there, swelling, which was spreading, and swelling was there, and these were complaints were spreading proximally in the upper direction since 8 to 10 days. Right? You can see the presentation. In this part, you can see even the pustules here. Right? Now, it was associated with mild muscular pain and pain abdomen, few pustular lesions on dorsum of the foot, and there was no fever. No fever. There was no fever. And the modern diagnosis was leukocytoclastic vasculitis. Leukocytoclastic vasculitis. Now consider morphologically, palpable purpura is there, pustules are there, the condition is acute and it is quick in spreading, right? Clinically, there is symptoms we are seeing: prashna pariksha, burning sensation, joint pain, and pain abdomen, right? And etiology, diagnosis, leukocytoclastic vasculitis, it is hypersensitivity. The condition is caused due to hypersensitivity. Now, whether hypersensitivity is etiology, karya, or karan? Hypersensitivity is karya or karan. If you want to understand it, then you watch my another video in this YouTube channel, that Ayurvedic management of allergic and autoimmune disorders, skin disorders particularly. There I have explained very nicely. Actually, hypersensitivity is not karana. It is the karya. It is the result of something else. You need to understand that, right? So, we'll consider Ayurvedic diagnosis. This same condition, we'll consider Ayurvedic. Now, morphological diagnosis क्या है? Raga, Puya, Shotha, and Visarpavan. There is erythema, pustules are there, Shotha is there, Visarpavan. It is spreading, right? Now, what symptoms? Clinical diagnosis, Daha, Ruja, Sandhi, and Udarshula is there. Etiological diagnosis, क्या चाहिए? What is needed? History. Let us take the history. Now, prior to the onset of the current complaints, patient visited her grandmother's home in Kolhapur. While playing, she was bitten by multiple ants on her both legs. As she was not aware about that, she was standing on the ant hill or in middle of the group of ants, and she neglected. Usually, kids when they are in playing mood, they neglect, like they just wipe, and she continued playing. And 2-3 days later, she started developing these lesions. Then they went to modern dermatologist, and the condition was diagnosed as leukocytoclastic vasculitis and treated. She was given steroids, antibiotics, and some painkillers also. Yet, with those also, it was increasing. There was no relief at all. Then the patient came to me. Then I tapered that steroid and all. Then we started our treatment and we got very good result. But how we did that one? Because of the history, we were able to diagnose it as Kitavisha, right? We were able to diagnose it as Kitavisha. Now, by combining the morphological diagnosis and clinical diagnosis, we can sharpen our diagnosis as in Kitavisha. We can make it as Pitta Pradhana Kitavisha. Pitta dominant Kitavisha. We are merging morphological findings and clinical findings, and then history that we took for etiological diagnosis. Etiology is Kitavisha. Now, what type of Kita? Pitta Pradhana Kita. And we treated this patient with Pittaja Kita Chikitsa, and this is the outcome. You can see. And we waited, I think she got rid of this in 24-25 days completely. She was free. And then these photos are after 6 or 8 months later. We wanted to publish, so that is why it was taken even after that much of follow-up, because leukocytoclastic vasculitis is a condition where even slightest trigger like mosquito bite or very spicy food or any medicine for any simple cold, cough and all can trigger its onset. And we observed the patient for almost 6 months. There was no any hypersensitivity reaction, even though the patient was exposed to such things, right? So this is the outcome. Now this patient, when this patient came to me, you can see hard hyperkeratotic lesions on the face, neck. What idea it gives about this V-shaped lesions on the neck, right? Anything like legs, on legs, only dorsum of the foot, and he had few lesions on the dorsum of the hand, and I forgot to document that one, right? What idea it gives? Only lesions are seen only on the solar exposed parts, right? धूप में जो एक्सपोज होते हैं सिर्फ वहां पे ही लीजन्स आ रहे हैं, right? And it was the diagnosed case of Darier's disease. This was the condition that first time I was now hearing about. Leukocytoclastic LCV is also first time I came to know about the disease when that patient came with that known diagnosis. This patient was also first time I came to know when this patient came with this presentation, like this diagnosis, right? Now, what is happening here? The lesions are caused only on the parts that are exposed to sunlight, right? As I told you, I am Agatantra person. So whenever epigenetic factors trigger the clinical presentations, it is said in Ayurveda that in Agada Tantra that we have to consider Dooshivisha. Now Karanat Karyanamana and Karyat Karma. So what is the definition? Like how we have to use the Dooshivisha definition for these type of diagnosis. The one where Jirnam Shagno Shilbiratamwa Davagni, ultimately what this says, low potent poisons. When we know that the person is exposed to low potent poisons and developed some disease, so we can say Karana. We know the exposure. Karana, Karana. Now, when we don't know, for example, in this patient, we don't know what was the exposure, but solar exposure is aggravating the condition, or solar exposure is trigger, right? So, this definition, Dushitam Deshakalana Diva Swapnaira Bhikshnesha Asma Dushete Datun Tasma Dushisham Tutum. Matlab, when a person gets exposed to regular change in the Desha or goes to different place, takes different food, right? Then all of a sudden condition is caused. When that exposure is not there, the person will be normal. So that gives the idea about Dooshivisha. So we diagnosed this case as Dooshivisha Janya, Vataka Pradhana Kushta, and we treated him very effectively. Here you can see the lesions are markedly reduced and the scars will be there. It takes some time to get the discoloration completely gone to bring normal color. But very importantly, now he can work under the sun without any skin lesions. Without any skin lesions, now he can work and walk under the sun. Right? You can see why we were, though unknown for me, Anukta Roga, but we were able to diagnose it, plan the treatment, and get the result also. Right? For example, this is another case, one of the most serious case. It was discharged from the modern medical hospital, saying that she cannot be treated. Right? You can see the patient developed these lesions as a result of drug allergy, and this was diagnosed as Dress syndrome secondary to NSAIDs with uncontrolled type 2 diabetes. Dress syndrome with NSAIDs with uncontrolled type 2 diabetes. Dress syndrome is drug reaction. Dress syndrome is drug reaction with eosinophilia and systemic symptoms. It's one of the serious conditions, right? Sometimes life-threatening also, right? And further, what happened now here? What was the diagnosis? Clinical diagnosis was that dress syndrome. Now, morphology, biopsy, it gave features or suggestive of erythroderma. It was erythroderma. So ultimately, the patient with the treatment, he landed into one more condition, complication, diabetic ketoacidosis with erythroderma, right? Rett syndrome due to NSAIDs with type 2 diabetes and diabetic ketoacidosis. Morphologically, erythroderma, right? So modern diagnosis is Rett syndrome to second NSAIDs with diabetic ketoacidosis and erythroderma. Now, what Ayurveda can do for that overall, when we look into the clinical presentation, scaling, erythema, burning sensation, pain, fever, vomiting, and weakness is there. So, clinical diagnosis is Pitta Pradhana Tridosha. When we look into the morphology, and the modern diagnosis, erythroderma, it holds good with Charmadala. It holds good with Charmadala. Raktam, Sakandu, Saspotam, Sargtalati. Talati, matlab, there is the scaling. There is scaling with raga, itching, burning sensation and all. So erythroderma. Etiological diagnosis as it is Rett syndrome, drug allergy. So it is Dooshivisha. So overall diagnosis is Dooshivisha Janya Charmadala. So overall, what was my consideration for treating this patient? Etiology, how we assessed? We assessed based on Karnath Karanamana. So we considered Rett syndrome that due to NSAIDs as Dooshivisha. Scaling and erythema was there, so we needed to treat for Paka, that is Pitta. So we targeted the treatment towards Pitta. Patient had ketoacidosis, which holds good with Vidagdajirna. So when you treat Pitta, at that time, Vidagdajirna also gets corrected. So ketoacidosis is also corrected. So overall, line of treatment adopted in this patient was Dooshivisha and Jwaragna Chikitsa. Dooshivisha and Jwaragna Chikitsa. And you can see the result. You can see the how toxic it is appearing here, and she is okay now. Though she had lost weight because of that reduced food intake during her hospitalization in modern hospital. Gradually, she improved in her weight and all. You can see before and after. Right? So with this, I think you are able to understand now how we can diagnose even a disease, skin disease is not explained, or it is explained but exactly we cannot find, or where the modern diagnosis cannot exactly fit in Ayurveda category, because most often we get the patients with known diagnosis, right? So at that time, fitting them or connecting them with particular known entity in the Ayurvedic text becomes difficult. So how it can be achieved, even though it is not exactly fitting any of the disease, how we can make out the diagnosis and how we can plan the treatment, how we can give better results. I think you understood by this patient, by these explanations and this video, right? If you want to actually practice Ayurveda dermatology and improve your practice, then I have an offer for you. I have created a 50 hours online Ayurveda dermatology package. It contains 30 hours on psoriasis course and 20 hours on dermatological manifestations due to visha. This 30 hours is called, we call it as psoriasis management mastery in Ayurveda, and second one is Ayurveda Dermatology. So overall 50 hours. It's completely online, anytime, anywhere, as many times as possible you can watch. It's lifetime. You get lifetime access, and there will be live sessions also. In comments, if you write us the questions, you can. We'll be discussing them. We have a very good community in WhatsApp community where every day our students are discussing about the cases that they are treating with these principles, and you will learn a lot. Actually, the price is more than 10,000. Offering on our website is 7,000, but exclusively for my YouTube audience, we are giving 700 rupees discount. Link is there in the description. Go to that link and use the promo code YT700, and you will get direct 700 rupees discount. And if you feel that you still want to know about my teaching, then you can join a small 3 hours training also. It's again a pre-recorded 3 hours training, application of principles of Ayurveda dermatology, completely case-based. Completely case-based, even understanding dosha assessment, everything is based on cases only. So you will understand how Hetu Samprapti, dosha assessment, Snehapana, Shodhana, Kleda, Krimi, Rasayana, patient education, how all these are useful or important in treating the patient. You will be learning all these with the help of treatment, like with the help of the patient. How, in which patient we use the importance, knowledge of Hetu and Samprapti, in which patient we use the knowledge of dosha assessment, like that. All the things are explained with treated cases, and it's wonderful opportunity. Don't miss the opportunity. Link for this is also in the description. Please join and improve your skills in Ayurveda dermatology. And for more information, you can contact me. And if you are new to my channel, please subscribe. And if you feel this video was worth watching, please like this. And if you have any questions, any queries, please write them in the comments. And if you feel it's worth sharing, and please share this with all your friends. Thank you for watching and being with us. See you again in next video. Take care. Take care of health. Read and forget. Read and forget. Don't forget to read. Namaste. Thank you.